China and others have criticised you for using the phrase Chinese virus. How do you feel about that? Are you going to continue using that phrase?
Well, China was putting out information which was false, that our military gave this to them. That was false.
The United States has, in the last few minutes, gone over the 6,000 case mark, the new official number, 6,010 active cases that have been confirmed by testing.
And rather than having an argument, I said, I have to call it where it came from. It did come from China. So I think it's a very accurate term. But no, I didn't appreciate the fact that China was saying that our military gave it to them. Our military did not give it to anyone.
Remember, the best guess among public health professionals is this is nowhere near the number of Americans walking around positive. We have lost 104 souls thus far as a country.
Critics say using that phrase creates a stigma.
No, I don't think so. No, I think saying that our military gave it to them creates a stigma.
China says it will revoke the credentials of Americans at 3 U.S. newspapers in response to new U.S. restrictions on Chinese media. The Foreign Ministry wants journalists working for the New York Times, Wall Street Journal, and the Washington Post, whose credentials are due to expire before the end of 2020, to hand back their press cards within 10 days.
The number of cases that we put up on the screen every day that we report to you is not remotely reflective of how many cases there actually are in this country or your state or your city. It's exponentially larger. And that's why you see hospitals across this country bracing for a surge in patients. A new study by Harvard paints a potentially grim picture of beds overrun well past their capacity.
It comes after the Trump administration designated 5 Chinese media outlets as foreign missions and restricted the number of Chinese who could work for them.
Tonight, more TSA officers are testing positive for the novel coronavirus, and the union, which represents nearly 50,000 of them, says the TSA is not doing enough to protect them. Everett Kelly is the union's president.
They want to work, very patriotic employees, and they just want to do their job and do it safely.
The TSA confirming 8 of their officers have tested positive for COVID-19, that number doubling within the last 4 days as more testing becomes available. The TSA says all employees these officers might have come into contact with over the past 2 weeks are also quarantined.
The government dramatically ramped up measures on social distancing because we were on course for a catastrophic epidemic. Computer models showed the impact on critical care units was likely to be twice as severe as originally been anticipated, and it wasn't just the elderly. As we know, younger people have a much lower fatality rate. Just 8 in every 10,000 infected 30-somethings die. But according to Imperial College scientists, significant numbers do need medical care. 320 in every 10,000 30-somethings with symptoms are admitted to hospital. And of those, 16 need critical care.
Rush hour this morning, a commuter ghost train. The train from Gatwick, empty. London's Covent Garden, a ghost town. One day after the government clamped down on socialising and work travel, the Prime Minister and the Chancellor tried to address the howl of pain from employees and businesses who fear they're staring into an abyss.
We must act like any wartime government and do whatever it takes to support our economy. And that's the main purpose of this press conference this afternoon. We must support millions of businesses and tens of millions of families and individuals through the coming months.
Doctors would end up having to choose who would live and who wouldn't. And she knows she would be one of the ones that wouldn't. And that shouldn't be happening at this day and age. So, but it's not going to, because we're on the ball.
I want to go through our overall plan for beating this new coronavirus. First, we must stop the disease spreading to a point where it overwhelms our NHS. And every country in the world has the same problem. This is a disease that is so dangerous and so infectious that without drastic measures to check its progress, it would overwhelm any health system in the world. And I've used the Italian health system. It is excellent. And the problem is not with the health systems, it's the numbers of sufferers.
Lawmakers now on both sides of the aisle are starting to ring alarm bells about the threat of this drug shortage here in the United States. Sources tell me that as China is really tamping down on the spread of the virus inside the country, this other new threat is now just beginning to ramp up. Fox was told by Senator Rubio that about 80% of the ingredients in drugs used here are made abroad, and that most of that 80% is coming from China. Take a listen.
Now, we don't know if there are going to be shortages. We anticipate there will be in certain drugs because those factories have been shut down because of the virus.
This worry does go all the way to the top. Even President Trump himself has brought this issue up. He did so with pharmaceutical execs over at the White House. He said his main goal here is to bring manufacturing back to America. He said if that happens, we can be much more self-reliant on the drug ingredients going forward. Pharmaceutical execs agree with him. The CEO of GeoVax told me last weekend the vast majority of drug ingredients today are made either in China or in India. He said it is a national security issue.
I thought we'd do a little morning shopping, and it's 6:58. And this is the queue at Sainsbury's before it opens at 7 o'clock. That is ridiculous. But I'm here too.
Well, British citizens are being advised not to travel anywhere in the world for the next 30 days because of the coronavirus pandemic. The Foreign Secretary, Dominic Raab, made the announcement in the House of Commons.
So with immediate effect, I've taken the decision to advise British nationals against non-essential travel globally for an initial period of 30 days and, of course, subject to ongoing review. Now, Mr. Speaker, I should emphasise this decision has been taken based on the domestic measures introduced here in the UK, alongside the changes to border and a range of other restrictions which are now being taken by countries right around the world. Following today's change in travel advice, British nationals who decide that they still need to travel abroad should do so fully aware of the increased risks of doing so. And that obviously includes the risk that they may not be able to get home if travel restrictions are subsequently put in place that they hadn't anticipated. So we urge anyone still considering travel to be realistic about the level of disruption they are willing and able to endure, and to make decisions in light of the unprecedented conditions that we face.
The European Championships is football's biggest party outside the World Cup. But UEFA, like sporting bodies worldwide, has pressed pause on celebrations like this. Wembley was supposed to be the centrepiece, hosting the semi-finals and final of a tournament held across the continent for the very first time. But now Euro 2020 has become Euro 2021 and the National Stadium is abandoned. Staff, including the boss, have been sent home for their own safety, now contemplating how football can survive unprecedented upheaval.
We're very